I am Dr. Arun Bal. I am a diabetic foot surgeon and specialist. I would like to share some facts with you as the World Diabetes Day is coming up on next month in November. Diabetes is a disease which affects all organs of the body. However, the organs which are commonly known which cause problem in diabetes are heart, kidney or eyes. Very few people, including most of the doctors, don't know that diabetes also can cause severe damage to the feet. In fact, the damage to the feet is one of the problems which causes lot of morbidity and mortality. Very few people know that an infected neuropathic ulcer, that is an ulcer which happens because of the nerves not functioning, uh, can have a mortality which is higher than even a breast, prostate cancer and Hodgkin's disease. Similarly, if the blood vessels are blocked because of a diabetes which causes a wound in the leg, then the mortality, that is a death because of such problem in a patient, is almost next to pancreatic and lung cancers. So patients should take regular care of their feet. Every diabetic patient must always do some basic care at the end of the day. You must wash the feet cleanly, wipe them, especially in the web spaces of the toes, because that is where usually the infection starts. And then always apply a very uh, little ointment or a moisturizer, which is a mild moisturizer, nothing very strong. And always cover the leg while sleeping with simple cotton socks. Never walk barefoot in the house. Always wear proper socks and diabetic footwear. It can be shoes, it can be sandals. Also, if patient wants to go, most of the Indians go to for a religious ceremony, they go for a pilgrimage, then they should not walk barefoot if they are diabetic. They must at least wear a special socks which are padded socks, which are called temple socks. Always keep your blood sugar under control. 3 months average, what is known as the HbA1c, should be below 7 or at least 7, because once it starts increasing more than 7, then the blood vessels and the nerves of the leg and feet start getting affected. If you have even the smallest wound on your feet, then immediately contact your doctor. But also regularly, once a year, meet your doctor to check the functioning of the nerves and the blood vessels, and if there are any other problems in the foot. That is something which can be detected by a simple examination. If you unfortunately get any wound on the sole of the foot or below the ankle, then the first thing one should do if one is diabetic is not to walk on that, because diabetics don't get pain as their nerves are not functioning. The patient is not worried about the wound, because normal perception is it's something which is not paining is not likely to be serious. But in diabetes, it is exactly reverse. A wound which is painless can be more dangerous than the wound which is paining. So, if you find that especially on your sole, there are some corns or calluses, never use blades, knives, or the medicines which are available as the corn caps and all, because they contain very strong chemicals and that can damage the foot. But once you start getting corns, you have to find out the cause of the corns, and that can be done by a regular foot examination and making alteration in your footwear. If that is done, then most of the people can walk around even after 30 years of diabetes without any problem in the feet. Similarly, if you are traveling where you have to sit for a longer time, always wear stockings, because sitting in one position causes swelling of the leg and the feet. So you must wear pressure stockings. Also, never, even in the house, walk completely barefoot. At least wear padded socks. So if you take care like this, I think feet can remain normal even for 35-40 years. Any amputation done, either of the foot or the leg, reduces the lifestyle. It changes the lifestyles. and non-activity which is required for the treatment usually affects the heart function. So you must be very careful. Even with a wound, if you have to walk, then there has to be a specialized footwear. There are a variety of other devices you can use to keep yourself fit and walking. So if one takes that much care, then I think one can be walking even with a diabetes and nerve function or a blood vessel function which is less. So this is a message. If all the diabetes keep in mind, then they can avoid the amputations and lead a normal life. Thank you.